The Scottish Dementia Working Group is run by and for people with dementia so that we can have our say on issues that affect us. We all have a diagnosis of dementia, but that doesn't mean we should be ignored and excluded. We still know what we want and we should be listened to. Established in 2002, the group is funded by Alzheimer Scotland and Comic Relief and has already had a tremendous impact on public policy, promoting the improved provision of services in Scotland and reducing the stigma that is often attached to dementia. In the past few years, our group has met with Scottish Government ministers and with many other people in positions of responsibility to make our views known.
We as a group could only lobby and do so much, but to have MPs on our side, they can carry their voice further and lobby it further in the Scottish Parliament.
We made our point very forcibly to the Minister that there are several things that we're very passionate about. One is early diagnosis. That's a long story in itself, but the sooner you're diagnosed, the sooner things can come into place and you can make arrangements to cope with the rest of your life. Other was respite, so we think respite should be a major thing, and yet it's very hard to get. And of course medication, we found out that if you lived in Edinburgh and you were diagnosed with the Alzheimer's type of dementia, you had to go on a waiting list to get Ariset. And we feel this is all wrong. So we wrote to the Minister and they wrote back to us, they've stopped the waiting list. You can now get Ariset based on medical judgments once you're diagnosed.
If you don't ask, you don't get. And if you ask making a lot of noise, if it's only to shut you up, they'll listen. And I found that works. And it certainly worked for us.
We believe that we should be involved in everything which concerns our lives for as long as we are able. It upsets us when people speak over our heads as if we weren't there. We don't want others presuming to speak for us when we can speak for ourselves. So we have adopted the slogan, "Nothing about us without us." The working group has campaigned for better access to appropriate short breaks which help family carers to cope and are a positive experience for us too.
Now I believe everybody who's entitled to respite should get respite. The respite, whether it be for a couple or individuals, is very, very important. This group would like to achieve respite in all areas for people who require it.
The Scottish Dementia Working Group was proud to be one of the partners in the first United Kingdom Convention of People with Dementia in Newcastle, England in March 2006. This event brought together people with dementia from many parts of the United Kingdom. It was planned by people with dementia, and the speakers were all people with dementia. It demonstrated that we have views and we have a voice. When we heard the slogan, "Living with Dementia, not dying of dementia," we immediately liked it. We are positive about our lives and we want to make the most of life while we can. Many members of the working group are prescribed medication for Alzheimer's disease and we believe that it has helped them. So when the National Institute for Clinical Excellence, or NICE for short, proposed that in England and Wales the existing medication should no longer be prescribed to new patients, we were determined to campaign to make sure that people in future have the chance we have had to benefit from these medications.
We've presented a petition demanding that Ariset be maintained and introduced as soon as they're diagnosed.
I think it would be disastrous if they do stop it, because it has benefited quite a number of people who have been on it. And I think to take something away when it's giving benefit to the person is wrong.
Another campaign the working group has been involved in has been about early diagnosis. We think it helps for the person to know as soon as possible that they have dementia.
Early diagnosis is important because it sets the pace for the rest of your life.
In Scotland, there is a policy document on overcoming the obstacles to good dementia care. Work is being done to set down the details of a care pathway to make sure that everyone receives the medical and social care they need at every stage. The working group has made its voice heard on policy issues.
There are more and more people going to have dementia in the future. We know that from the statistics. So it's important that people understand that dementia is not the end of the world. You go on living and you live with it. So I think that's the message I want to put across to people.
People who can affect policies should listen to us because we know what's wrong with us, we know what we're going through, and more importantly, we know what we need to help us get through life and not become a burden on the state. We do need support with some things, but not all things. Help us where we need it and let us carry on living independently.
Sometimes we are critical of the professional workers who provide dementia services. We think they should try harder to see things from our point of view. Working group members have been involved in local policy planning groups. They have also spoken to health and social care students.
People always seem to think they know what's best for you. You've not got a mind of your own. You can't make decisions for yourself. And I'm forever having issues with this. I want people to talk to me, ask me what I want.
Focus groups provide an opportunity for us to put our views to policy makers on a variety of topics. In the past year, we have taken part in groups on subjects ranging from what kinds of research we would like to see and how public transport could be made more dementia friendly, to how best to involve service users and what Alzheimer Scotland should be campaigning about.
People have preconceived ideas as soon as the word dementia is mentioned. They've got this straightforward tunnel vision thing that people with dementia just basically can't do anything for themselves.
It's very hard to get through to service providers and people actually pay the money, but I think services, they will be so impressed at what we're saying that they will change the services. Maybe not to the extent that we want, but there will be changes for the better.
Sometimes you would think, from the way people react to dementia, that it was something you could catch. We know the word often gives the wrong idea, but we want to challenge the stigma which is often attached to it.
That stigma is still there, so how do we challenge it? Is by having their own groups and having people and observers coming in, seeing how we work and operate, and that we operate to high standards. You don't come in the meeting and sit and mope about your worries. It's not like that. It's a very positive meeting and you're contributing, you're thinking, you're putting forward your ideas. So collectively, we're slowly breaking down the barriers of stigma.
Recently, the group wrote to the pharmaceutical company which produces Ibixa to say that we thought the image they were using of someone in the later stages of dementia was taking away the dignity of the person in the advert and gave too negative an image.
And the wording was very negative as well. Well, it was brought to our attention, and so we don't let things like that go unchallenged. We wrote to the drugs company and they sent a representative to our meeting, and she listened very carefully to us, and she said that she would consider what we said in any future adverts. What she didn't say, what came as a surprise, they changed the advert.
Everyone in the Scottish Dementia Working Group has found themselves doing things they would never have thought possible before their diagnosis, like standing up and speaking in front of a big audience. We have found the strength to do these things by supporting each other. Our group has given us the confidence to lead full and active lives in spite of our dementia.
I think campaigning with the Scottish Dementia Working Group has given me so much more confidence than I had initially. After the diagnosis, you think that you're not worth terribly much. It's a very foolish idea, but that's what you think. And then as you begin to come back into yourself, you realise that everybody's got something that's not quite right about them. You know, you're not unusual in any big respect. So therefore, working with the group of people who've got dementia has been so wonderful. I really love it.
Confidence just grew and grew and grew. And then I started going out and do talks and lectures and conferences. Once I got on that stand and said my first 2 lines, and I felt brilliant within myself because I'd done something that I've actually thought I would never ever be able to do. And it was just through the groups, give myself confidence to do it. I mean, you're living with dementia, no dying with it.
The Scottish Dementia Working Group exists to be a voice of people with dementia. We want to be heard. We support each other. We campaign for better services. We will keep working to change public attitudes towards people with dementia. We want to see more people with dementia speaking for themselves.